Americans suffer from hernias, but only 750,000 actually seek treatment. The consequences can be deadly if left unchecked. Dr. Timothee Friesen, general surgeon with Finney Trimble Surgical Associates at GBMC, joining us now with what we need to know about hernias. Good morning.
Good morning.
Okay, tell us what a hernia is.
So basically a hernia is a defect in the abdominal wall. It can be a weakness, and usually they occur around the umbilicus or in the groin. You can also have them in several other locations, but those are the most common.
All right, so it's this opening in the wall, and what is it that's actually protruding?
So most of the time it's just a little bit of fat from inside the abdomen, but you can also have a piece of intestine or other parts of the abdomen. You can have either even stomach or colon or other parts of the abdominal contents.
And is this something you can actually look down and see happening? Like a lot of people will feel a bulge, but can you, tell me what it looks like.
Most of the time you just feel it as pain initially. And then as it goes on, it can turn into a bulge. And the bulge occurs when you strain or lift something heavy or if you're exercising. And that bulge, you'd be able to push it back in. That would be a good sign that it's a hernia.
Okay, that would freak me out for sure. Absolutely. And I'm sure it does freak out a lot of people. Yeah. All right. Seeking treatment is crucial because there can be an actual rupture and lead to bleeding and
what happens is that if a piece of intestine gets stuck in that hernia and then it gets twisted, then you can lose the blood supply to that intestine and die, and that's when it can rupture. Usually you have about 6 hours if you have what's called a strangulated hernia. Which
6 hours?
Well, that's how long the intestine can survive without blood. But once the blood supply to the intestine is compromised, then you have about 6 hours until the intestines can die, and then you have to have part of the intestine removed.
And will you know when the beginning of that 6 hours starts? Will you feel?
Well, it'd be hard to know for someone who's never had one.
Okay.
But yeah, you'd have severe pain. You'd have maybe some redness over the area. Basically, if you feel severe pain in an area of swelling, either in the groin or the belly button, you should definitely go to the ER or call your doctor right away.
Yes, the bottom line is get this pain checked out. Don't wait. And the treatment for this, is it only surgery?
Not necessarily. A hernia that's not symptomatic and it's very small, sometimes we can watch them. But most hernias in general require treatment, either surgery. Well, surgery is really the only treatment.
Okay, and so for a surgery, what's the recovery time?
Depends on how big the hernia is. Usually I'll tell people they can't lift anything heavy for about a month. But a lot of them can go back to work even a week after the surgery sometimes.
All right, and then some women can actually develop hernias while they're pregnant. And I understand the treatment for that is definitely surgery after delivery, depending.
Sure, yeah, you really try to wait, obviously, until after the delivery. Yeah, most hernias require surgery, yeah.
Okay, all right. Well, doctor, thank you so much for joining us this morning. Really appreciate it. Some good information. If you have pain, check it out.
Definitely.
All right. Don't go away. When we come back, some of the fashions to keep you cool in the summer heat. First, though, a look at some of the